Doctors, pretty important. I don't think I could live without them. Not sure if you could live without them. Very important. Thank you, doctors, for being so amazing. Hey, welcome to another video. My name is Mason. Hope you're having a great day. Thanks for spending just a few minutes of your day with me. If you hear a bell in the background, that is indeed not a doctor or Santa Claus. That is my cat, Hero. Today we're watching another video. This is a Jubilee video. Find the real doctor. We'll see how it goes. I'm excited about this one. I think it's going to be pretty good.
Hey good humans, it's Jason and Jada, the director of this video.
We just want to give a quick shout out to our sponsors, Janu. They're the ones that provide...
Janu does not pay me. They pay John Yu. They pay Jubilee.
So, how are we feeling?
Oh, we're feeling good. We're feeling good.
Yeah, I feel like maybe a little more confident than I should be now that I get a look at you.
They ain't ready. They ain't ready. Okay, numbers 1 through 6 in that order. Could you tell us your specialties and what school you went to?
I'm a dermatologist and I went to UCI.
I'm a urologist and I went to University of Tennessee.
I'm an emergency doctor and I went to UCF as well.
Physical therapist, Rutgers University.
I'm a pediatrician and I went to Drexel University.
I'm an optometrist and I went to Southern California College of Optometry.
Number 6, can you tell me what 20/20 vision means?
Yeah, so basically it's kind of complicated. There's a lot of like physics to it, but there's a certain angle that's subtended by the letters that are on the Snellen chart that you're looking at, and so they standardize that at 20 feet distance. So if you're 20/20, you're seeing what someone should be seeing at 20 feet. But if you're 20/30, what someone can see at 30 feet, you need to be standing at 20 feet in order to see.
I didn't know that. It's very interesting. I actually have some weird vision. This eye is apparently 20/20. This eye, 2100. Apparently that means to see what somebody with normal vision would see at 20 feet, I have to be at 100 feet. Wait. To see what somebody else would see at 100 feet, I have to be at 20 feet in this eye. Very interesting. The more you know.
What was your least favorite thing to be woken up by?
During my residency, I actually had a case of Stephen Johnson's, and that was very scary to see.
A large accident with fatality is always a grim thing to come into, especially if children are involved. So that's the worst thing that I've ever had to do.
I got a little bit annoyed with the Tylenol call, but you know, I had to do what I had to do. So.
My emergencies are mainly during like a practice or a real game. I've had ankle injuries that needed to be like lowered inflammation and what
Oh, the pictures. Oh, the pictures. Something you should know about me, I am not good with like bones breaking, blood, bruises. Not good with that kind of stuff. So maybe this isn't the video for me. Maybe I should just take my medicine and stop watching this video. That was a doctor joke. Medicine doctor. It was really stupid and I regret saying it.
for certain massage therapy.
I think just seeing any babies in pain and then seeing like a tragic loss is the hardest thing.
I didn't realize that this episode would be so dark, and I apologize for subjecting you to that.
On call as much, honestly, but I did have to see a patient for like herpes in his eye. So
herpes in your eye? How do you know what? Never mind. There's literally nothing I would want to know less than how you got herpes in your eye. So I'm just going to not complete that question.
I graduated medical school at 2021.
I've been practicing for 15 years.
I finished my residency at USC Medical Center 5 years ago.
And I've been out of school for 1 year.
Doctor number 1, I have a question. For the medical terminology, intra versus inter, since you're a dermatologist, what's the difference?
Yeah, so it has been a while since I've been in medical terminology, but I definitely use...
Didn't you graduate a year ago? You were in school not long ago, so... Lady, you should know that intra and inter are different things and what they mean. I'm not a doctor, so I don't know. This is why we need you, so...
lot, and that would be inside, and then intra, gosh, I don't remember off the top of my head.
I suspect that she may not be a doctor if she doesn't know what intra is. My fiance is in nursing school, and I feel like I've heard inter and intra quite a bit from her. I feel like that's pretty common in like the medical field. Again, I don't know, but this is just, off the top of my head, what I'm thinking, for whatever that's worth, and I can go ahead and tell you it's not worth very much at all. So
4. Can you name me the different kinds of cruciate ligaments?
3? You said 3?
However many there are.
Oh, we got the anterior, interior, you have meniscus. Those are the main for knee.
Gotcha.
I feel like that was a pretty smart answer. So I don't know why that girl was looking so sus. Maybe she knows something that I don't. I mean, I don't know what those ligaments are. I've heard of meniscus, but the other two, I couldn't even tell you what he said.
3. What system is the lymph nodes a part of?
The lymphatic system.
Why are they so sus of everybody? Do they know that one of these guys, or 5 of these people are like, they're doctors, they're telling the truth? Like, I feel like every answer, they're like, okay, all right, lymphatic system, sure. Meniscus, sure. Like, dude, shut up. That was kind of rude, but don't be so sus of everybody. It's not cool.
Are we allowed to eliminate 2?
No, just 1.
Okay.
Why? I haven't seen anything that has made me want to eliminate any of these people. I'm going to be real. Maybe doctor number 2, but I feel like it's just because the other team eliminated him. I don't know. I feel like that's the only reason that I would want to eliminate him. I feel like everybody seems like a doctor to this point. I don't know why you would want to eliminate 2 this early. It's a little nuts to me.
Ready.
As a reminder, if both teams eliminate the same person, that person will be removed from the game. And I asked him to name...
So does nobody get removed since they did not eliminate the same person? Or did they like fight to the death? That would be cool. I want to see that. Maybe not to the death, but maybe they can like joust or like play checkers. That would be interesting. They could one-on-one in Call of Duty for who gets eliminated, who survives.
Cruciate ligaments, and he answered with
Meniscus?
which is not a cruciate ligament.
Oh, I mean, I don't know that that's true, but if that is true, that's pretty sus.
A physical therapist, you should probably know that.
Doctor number 5, could you tell me a common medication that you prescribe for one of your patients?
Benovate, it's for babies that have fibrosis before they get circumcised. We try that method first. An average is like 50 milligrams.
Doctor number...
Very good answer. Like a lot of information in that answer. I like this. She's a doctor. I'm going to go ahead and get that off the table.
I had a question for you too. For a baby under 28 days, if they had a fever, how much Motrin would you give them?
Ideally none.
Ooh, she knows her stuff. Okay.
Oh, it's a trick question. Number 5 is safe in my book. She's a doctor. I think that number 4 is the one that I'm the most sus of right now. Is sus still a word? Or am I like overusing that right now? Probably overusing it. Am I going to stop though? No. Because that would be sus.
Doctor number 6, if the patient had glaucoma, what kind of prescription would you give them?
You could give them something called latanoprost. So it's an eye drop. You do that one at nighttime only, in whichever eye had the glaucoma.
And then what would be the abbreviation for nighttime only?
QHS.
Quick answers. I'm literally, I think number 4 is the only one that I'm like, that's not a doctor. Also, he's a physical therapist, so I know that that's like a medical professional, but is that technically considered a doctor? I mean, I genuinely have no idea, so if you know, let me know.
1 and 4, could you tell me what kind of cars you guys drive?
I think doctors could drive anything. I feel like I've known doctors that have driven Priuses. Also doctors that have driven, Wagoneers. I feel like that's a dumb question. I'm not a fan, but number 4 is who I'm sus of. So maybe he'll say like, I don't actually drive a car. I skateboard to work. You're going to be in a Honda Odyssey.
I drive a Toyota Honda Highlander.
So
A Toyota Honda Highlander. This guy knows his stuff.
Driving the same car since I was 15. I drive a Honda CR-V. I am still paying off medical school.
I was pretty close with one. CR-V, Odyssey. It's like, Odysseys are like the minivan version of the CR-Vs. I feel like that was a pretty good guess. Shut up, okay? I thought it was a good guess.
I think we're ready to make another elimination.
Based off of the car they drive. That really proves whether they're a doctor or not, I believe. eliminated. Number 4. Yeah, he's definitely like a car salesman or something. I don't think he's a PT.
I would love to hear your wackiest story from a patient on the job. Down the line, sorry. I'd love to hear from all of you.
So we had a TikTok star in one time, and when I entered the room, he was standing on the medical bed, filming something, pretending he was surfing. So that was definitely very interesting.
TikTok has created the weirdest culture. Like, I feel like some TikToks are really good, but then you have the guys that are like, have the super flippy, floofy hair, and they're standing on hospital beds pretending to surf for clout. Clout has really distorted like our society. By the way, if any of you guys want to give me some free clout, that would be cool.
She and her friend had been playing around with a bottle and created a vacuum, therefore lodging the bottle.
I'm not a fan. Why would you do that? Like, people do the dumbest things. Gosh.
I had this elderly patient. She has some sundowning, some form of dementia, but she kept asking me to go to the bathroom with her to show her a good time.
Okay. Awesome. Just because you're old doesn't mean that you can't be shown a good time, I suppose, by a young doctor.
To me, is it okay to put false eyelashes on her newborn baby for pictures?
What the heck are these stories? Is this like what doctors go through on the day-to-day? Can you imagine walking in and like false eyelashes are on the baby for pictures? So weird. Caroline, my fiance, once put false eyelashes on her dog growing up, and it is the funniest picture ever. I'll try to find that picture and put it right here. Enjoy this picture of Charlie with false eyelashes.
I had a guy come in because he was playing with a Nerf gun, and then I guess he got hit in the eye, and then he ended up having like traumatic uveitis, and then he got some glaucoma as a result from that. So that.
Okay, eye stuff and mouth stuff and nose stuff, I feel like that is the worst kind of medical thing to go through. Eyes freak me out so much. When somebody has like an eye infection, it like messes with me. It makes me want to hurl. It's disgusting. And then like snot and mouth stuff, teeth. I could never go into the medical field ever. I would hate my life.
We're good to eliminate.
Oh, so like, why? I feel like the bottle story was very like believable and like very disturbing. So I would not have eliminated him. I think right now for me, my elimination would go to, I think the young doctor that said that the old lady wanted to go to the bathroom with him. I feel like that's a generic story that you could like come up with. That's my elimination as of right now.
Doctor number 2.
Sorry, sir.
Thank you. Bye-bye.
The hat tip. I did not want to see that guy go.
So we eliminate number 2 next because there were very broad answers given. It wasn't very like specific to what a urologist actually does.
This is a question for doctors 3 and 5. You walk into the room and you see the patient's monitor flatline. You feel their pulse, there's nothing there. How many joules are you going to shock them with? Doctor number 5.
It's kind of a dark question, if you ask me. I don't know why, but like my mind just now when she said how many joules are you going to shock them with? They have like, do you remember, I don't know if people still do this, but like the little joules that people used to like vape out of, jewel out of, whatever. Like just like sticking it in their mouth and like pressing the button, jouling, making them jewel. You'd have 15 joules in their mouth. They'd be like, now that's high quality nicotine. Right. Be quiet.
And doctor number 3.
200.
Doctor 1.
It has been a while since I've been in the ER.
5 and 200 are very different. So I feel like we're about to have an elimination based off of that.
I am a dermatologist after all, but if I remember correctly, it's 150 joules.
It's all different. Okay. Very interesting. 150, 200, and 5. So how do you eliminate one person from a wrong answer?
Doctor 6.
Yeah, so I definitely don't work in the emergency room, so I don't really work with that. I'm not sure.
That's fair.
Okay.
That was a question everyone got wrong. The answer is none, because you don't shock asystole. But that's something medical TV sometimes gets wrong. Everybody comes in there with the paddles ready to go.
I don't know.
I feel like I'm learning a lot from watching this right now. So if somebody's flatlining, you don't shock them. I guess CPR would be like the thing to do. I'm not sure. I am CPR certified, but never had to do it, and I hope that I never do. I feel like they're just having to eliminate random people. Like I don't know what they're basing that off of. I feel like technically she was the closest to the correct answer because you'd say 0. She said 5. That'd be closest. So I don't know what they're basing that off of, why they're eliminating her. I legitimately feel like they're having to just it's kind of a shot in the dark at this point.
Okay, I have a question for doctor number 3. So earlier I asked you what system the lymph nodes are a part of. You said the lymphatic system. What's the major system that it's a part of?
I know it's
Sus.
was like dead cells, fights off infections and whatnot. I'm just like at the tip of my head. I'm just like nervous right now, so I can't.
Doctor number 1.
Sus.
You know what the answer is?
I believe it's the circulatory system.
Doctor number 6, do you agree?
The immune system.
Sweet. Okay.
I feel like we're not getting anywhere. These are different kind of doctors. I guess you can't expect them to know all of this stuff.
5. What is the average heartbeat of a newborn versus a 1-year-old?
For a newborn, it's lower, so maybe like 35 beats per minute. It elevates by the time they're 1, obviously, so maybe like 40, 45.
Okay, I'm ready to make an elimination.
She might be eliminated based off that answer. It didn't sound super sure.
Dude, yeah.
Okay.
Doctor number 5.
Thank you. She talked about the heartbeat for a baby. That gave it away.
She answered that a resting heart rate of a fetus or infant is 35, which would be very concerning if it was that. They'd be not alive.
Okay, I think we're gonna have a demonstration. We're just gonna have Dr. Number 6 do a little eye exam with my pen light on Andre.
I feel like I've misunderstood this game the entire time. I think that it's 5 fake doctors and 1 real doctor. I thought that it was 5 real doctors. Sorry about that. Real deal. I mean, I feel like I should have known by find the real doctor. Uno. Singular. Not my finest moment.
And tell us what she's looking for.
Let's see what Dr. Number 6 got. She'll probably know.
You know, skills in action.
Alright, so first I'm going to be checking to see if your pupils are equally responsive to light and if they are equal in terms of size. I'm going to do the direct response first, so just look straight ahead for me, please.
I feel like she's the doctor. That's my guess. Now that I know that I'm not guessing who's not a doctor.
So when I shine it between the 2 eyes, I'm looking to see if the other one stays constricted, because that means that there's like a good communication between like the brain. So
Not a very doctor answer. I might take back what I just said.
that's what I'm looking for.
Number 1. Can you tell me what medication you typically prescribe to patients with cystic acne?
Yes, so if the acne is bad enough, we're going to put them on Accutane, but that is a high-risk drug, so we have to make sure that the women come in every month and give us a pregnancy test. And then I also recommend to not drink very much when you're on that medication, and that goes for men as well.
Last thing, does a bar of soap clean the face pretty well?
It can, yes. I have some patients that don't even use soap when they wash their face, and they have beautiful skin, so it kind of just depends on your physiology.
I genuinely have no idea who's a doctor or not. I have no idea. I feel like all of these people are doctors. I don't know what's up with this guy's face right now. Kind of strange.
Doctor number 6. What is that machine called that blows air into your eye?
Yeah, so that's called it's a non-contact tonometer. It measures your eye pressure to screen for conditions like glaucoma.
The cones that are in our eye, what do they do?
So they help you perceive color.
What colors do we see?
Okay, sorry, I'm trying to think.
Sus. She's scrambling. She's not the doctor. It's number 1. Duh. I've known it the whole time. I've been making sure you guys were paying attention. Paying attention is just what I said. Is just what I said is what I just said. Oh my gosh. What is wrong with me?
Red.
Roy G. Biv, baby. Red, orange, yellow. Green, blue, indigo, violet.
Red, green, and yellow.
I feel like I've just proved in this video how dumb I am. Really, truly. How unknowledgeable that I truly am.
Talk me through intubating someone. What are you trying not to accidentally push it down instead?
You're not trying to push out the tongue so that they don't or it doesn't block the airway.
Okay. I'm gonna ask one more question real quick to doctor number 1. Somebody has a mole. They want to get it checked out. What are some things they should look out for?
So changes in shape, color, if there's any pain, that's definitely something we want to know. And then throughout the mole, if there is different kinds of colors and textures, that's something that we want to look at as well.
I hate medical stuff. I hate that I have to go through medical things. Freaks me out. Moles, changing colors. Ugh.
That is all I needed. One of you is a real doctor. The other 5 of you are going to jail for impersonating a doctor.
Sounds to me like you're taking this too seriously, ma'am. You need to take a chill pill. I said take a chill pill is what I meant to say. I cannot talk today, and this is not good. Maybe I should see a doctor for not being able to be smart and talk.
We think the real deal is doctor number 1.
Dermatologist.
Oh, I agree. I'm sorry. I meant to put in a guess and say a guess. I think that it is doctor number 1. I just forgot to do it. So, doctor number 1's my guess. I don't think that the other 2 are doctors. I think it was doctor number 6. I think she struggled too much with the last question, like what colors we see. I feel like I know that. Maybe Roy G. Biv kind of deal. And then doctor number 2, the kid, the younger guy that said old ladies like to bring him into the bathroom. I feel like he's a little bit maybe too young. Like I feel like he's early, like mid-20s. I don't know. I feel like he's a little young to be a doctor. Could be wrong though. I'm not sure.
She was knowledgeable about everything that she explained. She didn't really know the jewels, but like she said, she's not in the ER very often.
We think the real deal is doctor number 1.
Okay, I'm glad we can all agree on who the doctor is.
Didn't follow on any of her answers, and the more that she kind of got into it, the more I felt that like she was a doctor talking to me as a patient.
I felt like that too. That's something that I was gonna say earlier, but I thought it would be kind of weird. Doctors always seem to calm me down when I'm sick or worried about something. I feel like she's got kind of that doctor energy that could calm me down. I feel like dude in the middle here, he'd be like, "Sup, bro? So you are gonna die. Sorry about it. I'm gonna go hook up with this old lady in the bathroom." And then this lady right here would be like, "What colors do you see?" So doctor number 1, she's got the vibes going.
If the lights on the floor turn green, that means that you have chosen the real deal. If they turn red, that means that you have chosen an imposter. The real deal will be revealed in 3, 2, 1. Oh.
No! I genuinely thought that was the doctor. I'd like to know what she does. She's an actress for sure.
Who is it?
Okay, she needs to stop flexing on us with her sick dance moves. A doctor, not a doctor, not a doctor, not a doctor.
I am not a doctor. I was in the medical field. My original plan was to be a PA, but then I left medicine. I went and got my MBA, and now I'm in marketing.
Hey, same here. Except I was never in the medical field. I'm too squirmish. Also, I'm out of breath from doing the bit on the wall there. I know, it was good. It was good dance moves.
I stopped working in healthcare 4 years ago, so it was a bit of a memory kind of situation. I was an MA for dermatology and plastic surgery private office.
Because you were not able to find the real deal, we will reveal them.
I feel like, so medical field, they always have PT, physical therapist, and MD, medical doctor. I don't know what it really stands for, but NP RN, registered nurse. And so I feel like she said MA and it's like marketing assistant. I don't know. I thought that was pretty funny. Really? She didn't even know like the Roy G. Biv thing. Wouldn't want her checking out my eyes. She might get lost.
It was right there.
I should have got off the phone.
Hi, I'm Nicole, and I'm the real doctor. I think sometimes maybe the way I speak can come off a little ditzy. I don't know if it's just my own persona of myself, but I feel like some people don't really look at me and assume that I could be a doctor. I think that Doctor Number One did an amazing job. Like, I literally would go to her.
That was really good. That was a good video. I liked that. That was a fun one to do. I do think that the winner gives off doctor vibes now that like I've heard her talk. I don't think she's ditzy. I just don't think that... I think you're nervous when you're up there and you can't give off your Roy G. Biv.